In this video, we will discuss about class 2 malocclusion, definition and classification and its subdivisions, etiological factors that are causing class 2 malocclusion, and the features we can look for class 2 malocclusion. Okay, let's get started. So, first we will talk about the definition. The definition of the class 2 malocclusion is that the mesiobuccal cusp of upper first molar falls mesial to the mesiobuccal groove of the lower first molar. You can look in the picture, the molars that are pink in color. We are in this, according to this definition, we are focused on the upper molar. Okay, so if we look for upper molar, then it is mesial to the mesiobuccal groove of the lower molar. This definition is correct. Okay, so now there is another definition we can also say, but it is also correct. Okay, so it is that the lower first molar is distal to the upper first molar. So again, look at the picture, that if we focus on the lower first molar, it is distal in position to the upper first molar. It is also correct, and this malocclusion is also class 2. Now we will move on the classification of class 2 malocclusion. So it is the British Standard Institute classification. It is that the lower incisor edges lie posterior to the cingulum plateau of the upper incisors. Okay, so according to this definition, now we are dividing. This is the class 2 malocclusion, as you know. So okay, now the division 1 is, also focus on the picture please. Division 1, the upper central incisors are procline. You can see in the picture the central incisors are procline and the average inclination, and there is an increase overjet. In division 1, their central incisors are proclined and overjet is increased. Now division 2, the upper central incisors are retroclined. So look at the picture, the central incisor difference in division 1 and division 2. The central incisors are proclined, but in division 2 the central incisors are retroclined, and in division 1 the central incisors are proclined, and the overjet is increased in division 1 and overjet is minimal or increased in division 2. Now we will talk about subdivisions, that means types of class 2 division 2. Type A. In type A, the central incisors are retroclined and lateral incisors are proclined. Now type B. In type B, the central and lateral incisors both are retroclined and the canines are buccally placed. So look at the picture, both the central and lateral incisors are retroclined and the canines are buccally placed. If you compare to type A, the difference is that the central incisors are retroclined and the lateral incisors are proclined, and there is no canine buccally placed. It is normal in position. Now we will talk about type C. In type C, all anterior teeth are retroclined. Now we will talk about etiological factors of malocclusion, class 2. Number 1 is heredity. Heredity is a factor that can cause class 2 malocclusion. The other factors are habits like thumb sucking and tongue thrust. There are also other habits that can also cause class 2 malocclusion, that are lip thrust, lip trap, the central incisors you can see in the picture, lip biting. It's also a bad habit, it is an etiological factor that can cause class 2 malocclusion, and nail biting. As you can see in the picture, the child is biting her nails. That are the habits occasionally child do and they continue till adult, but it's not a good habit. So there are also other factors which can also cause class 2 malocclusion. So we will talk about that are speech defects, abnormal sucking habits, and psychogenic problems. So these all are the factors that are contributing to class 2 malocclusion. Till now we know what is class 2 malocclusion, and we also know about the upper molar relation and the lower molar relation. Okay, so we will consider them both are right. Next we talk about what is the classification of class 2 malocclusion. There are two divisions, division 1, division 2, and their subdivisions A, B, C. Okay, and then we talk about what are the factors that are causing this malocclusion. Now